Hello, I'm Dr. Sarah Mitchell, and today I'm going to save you from a decision that could change your life, but maybe you don't even need it. If you just received an elevated PSA result and your doctor is already scheduling a biopsy, wait. This video is essential before you make that decision, because here's the truth. Not every elevated PSA means you have prostate cancer, and not every elevated PSA requires a biopsy. I've seen countless men rush into procedures they didn't need, causing unnecessary anxiety, complications, and costs. But I've also seen men ignore warning signs because they didn't understand their numbers. So before you do anything, I need you to. First, hit that subscribe button. This channel is dedicated to men's health, and every week I share evidence-based information that could literally save your life. If you subscribe now, you'll never miss critical information about your health. Second, comment below right now and tell me, what's your PSA number? Have you been recommended for a biopsy? Your comment helps me understand what matters most to you, and it helps YouTube show this video to more men who need to see it. And third, check the first comment and the description. I've included a link to a scientifically formulated supplement specifically designed to support prostate health. This is something I personally recommend to my patients, and it can be a game changer in your wellness journey. Now, let's dive into the facts that could change everything. Let me start by telling you something that might shock you. The PSA test was never designed to be a perfect screening tool for prostate cancer. The PSA, prostate-specific antigen, is a protein produced by the prostate gland. When I say elevated PSA, I'm talking about levels in the bloodstream. But here's what most men don't know. PSA levels can be elevated for many reasons that have absolutely nothing to do with cancer. Let me list them for you. Number 1. Benign prostatic hyperplasia, or BPH. This is simply an enlarged prostate, something that happens to almost every man as he ages. An enlarged prostate produces more PSA, but it's not cancer. It's as normal as getting gray hair or needing reading glasses. Number 2, prostatitis. This is inflammation or infection of the prostate. It can be bacterial or non-bacterial. If you've had a urinary tract infection, a recent urological exam, or even aggressive ejaculation, your PSA can spike temporarily. This is completely reversible and has nothing to do with cancer. Number 3, recent urological procedures. If you had a cystoscopy, a urinary catheter, or even a digital rectal exam shortly before your PSA test, your levels will be elevated. This is temporary. Number 4, intense exercise. Believe it or not, cycling, especially intense cycling, can elevate PSA levels temporarily. I've had athletic men panic because their PSA was elevated after training hard. Number 5, recent ejaculation. PSA naturally enters the bloodstream after ejaculation. If you ejaculated in the 24 to 48 hours before your test, your PSA levels will be higher. So when you get that call saying your PSA is elevated, the first question isn't, do I have cancer? The first question is, why is it elevated? And this is where so many doctors, and I say this with respect to my colleagues, jump straight to biopsies without asking these important questions. They see a number above 4 and they schedule a biopsy. But they're not practicing medicine, they're practicing fear-based medicine. Now let's talk about the specific numbers in this video's title: 5, 20, and 500. A PSA of 5 ng per ml, nanograms per milliliter. For decades, 4.0 was considered the threshold for normal. Anything above 4.0 was elevated. But here's what modern urology has discovered. That cutoff was arbitrary. It wasn't based on the most current science, it was based on older data. Today, we understand that PSA can vary based on age, race, family history, and even prostate size. A PSA of 5.0 in a 70-year-old man with an enlarged prostate is very different from a PSA of 5.0 in a 45-year-old man with no family history. If your PSA is around 5, this is in the gray zone. It's worth monitoring, but it doesn't automatically mean you need a biopsy. What matters is the velocity. How fast is it rising? A PSA that jumps from 3 to 8 in 1 year is more concerning than a PSA that has been slowly rising over 5 years. A PSA of 20 ng per m. Now we're talking about a genuinely elevated number. A PSA of 20 indicates something significant is happening in the prostate. This could be advanced benign enlargement, a serious infection, early stage cancer. At a PSA of 20, a conversation about biopsy is absolutely warranted. But even here, we don't automatically biopsy. We look at the whole picture. We do imaging. We assess risk factors. We might recommend a PSA density test or a genetic test like the 4K score or PHI test. These are sophisticated tests that help us understand if cancer is actually present. A PSA of 500 ng per m. This is extreme. A PSA of 500 is almost certainly indicating advanced prostate cancer, likely cancer that has already spread beyond the prostate. At this level, we're not asking, do we biopsy? We're asking, what stage is this and what's our treatment plan? But here's the important part. Even if your PSA is 500, a biopsy might not be necessary. Advanced imaging like MRI or CT scans can often confirm the diagnosis. And in fact, if cancer has already spread, a biopsy of the prostate might not change our treatment approach. So the numbers 5, 20, and 500 are like the difference between a caution light, a warning light, and a red emergency light. But even with a red light, you need context. Here's the million-dollar question. When is a biopsy actually necessary? As a urologist, I recommend a biopsy when we have reason number 1, persistent elevated PSA with rising velocity. If your PSA is consistently above 4 and it's rising at more than 0.75 ng per m per year, that's concerning. But even then, I want to rule out infection and inflammation first. Reason number 2, abnormal digital rectal exam. If I feel a hard nodule, an irregularity, or asymmetry in the prostate, that warrants investigation. A biopsy makes sense here. Reason number 3, suspicious MRI findings. Modern MRI technology, specifically multiparametric MRI, can identify suspicious areas in the prostate. If we see something concerning on MRI, we use MRI-guided biopsy to target that specific area. Reason number 4, strong family history combined with elevated PSA. If your father, brother, or grandfather had prostate cancer and your PSA is elevated, the risk calculus changes. In this case, a biopsy might be appropriate. Reason number 5, genetic risk factors. Men with BRCA mutations, men of African descent, or men with a strong cancer history in their family need different risk stratification. But here's what I don't recommend. Don't biopsy based on a single elevated PSA reading. One number doesn't tell the story. Repeat the test. Get a baseline. Don't biopsy if you just had a urological procedure, infection, or recent ejaculation. Wait 6 weeks and retest. Don't biopsy based on PSA alone. Use additional tools like PSA density, PSA velocity, free PSA percentage, or advanced biomarkers. Don't biopsy without imaging. An MRI can identify which men truly need biopsy and which can be safely monitored. And here's something critical. Transrectal ultrasound-guided biopsy carries real risks. These include infection, bleeding, urinary retention, and sepsis. Yes, life-threatening sepsis. It's not a risk-free procedure. So we need to be sure we need it before we do it. If you're in that situation right now, elevated PSA, biopsy recommended, here's my action plan for you. Step 1, verify the test. Get another PSA test from the same lab. Make sure this isn't a laboratory error or a temporary spike. Wait at least 6 weeks, and in that time, avoid cycling. Avoid sexual activity 48 hours before the test. Avoid urological procedures. Get tested in the morning and make sure the lab notes your age, race, and family history. Step 2, get a urinalysis and urine culture. Rule out infection. If you have an infection, treat it and retest your PSA in 6 weeks. Step 3, discuss imaging. Ask your doctor about multiparametric MRI. This is a non-invasive test that can identify if there's actually something suspicious in your prostate. If the MRI is normal, the risk of significant cancer is very low. Step 4, consider advanced biomarker testing. Tests like the 4K score, PHI, or prostate health index use PSA and other proteins to better predict the likelihood of aggressive cancer. These are more accurate than PSA alone. Step 5, calculate your risk. Use the American Cancer Society Risk Calculator or the Memorial Sloan Kettering Nomogram. Plug in your age, race, family history, PSA level, and DRE findings. See what percentage risk we're actually talking about. Step 6, get a second opinion. If a urologist immediately recommends biopsy without these steps, see another urologist. Seriously, this is your health. Step 7. Support your prostate health. While you're getting these workups done, optimize everything you can control. This is where that supplement I mentioned in the description becomes valuable. Look at the link in the first comment. It's specifically formulated to support prostate function, reduce inflammation, and promote healthy PSA levels. My patients have seen remarkable improvements in their PSA trajectories when they combine medical monitoring with proper supplementation. So here's what I want you to remember. An elevated PSA is not a death sentence. It's not even automatically a diagnosis. It's a signal that warrants investigation. Thoughtful, comprehensive investigation. You deserve medicine based on evidence, not on fear. You deserve doctors who take time to understand your complete picture before recommending procedures. And you deserve to take an active role in protecting your prostate health. This is why I created this channel, because men deserve this information. And honestly, many doctors don't have time to explain it like this. So right now, I need 3 things from you. First, subscribe. Hit that subscribe button. Comment on this video. Tell me your PSA number. Tell me your concerns. Tell me what other urological health topics you want me to cover. Your comments help me create the content that matters most to you, and they help YouTube show this video to thousands of other men who need to see it. Second, check the first comment and the description. I've included a link to the prostate health supplement I recommend to my patients. This is not just marketing. I've carefully selected this product based on clinical research and my own experience seeing results. If you're dealing with elevated PSA or prostate concerns, this supplement can be part of your comprehensive health strategy. Third, watch this video with someone you care about. Share it with your father, your brother, your friend who just got an elevated PSA result. Because the next man who sees this might be you 5 years from now, or it might be someone you love. And if this information helps even one person avoid an unnecessary procedure or catch cancer early, then this video has done its job. Your prostate health matters, your life matters, and you deserve to make informed decisions based on complete information. I'm Dr. Sarah Mitchell, and I'll see you in the next video. Take care of yourself.